Are you one of the millions of women suffering from ovarian cysts? If you are, we're glad you found us, and we're here to help you reverse this devastating condition and to take charge of your health. Ovarian cysts can make life challenging, and for some women it can be a life sentence, destroying their self-esteem. The heartbreaking symptoms of ovarian cysts, like sudden weight gain, acne, body hair, and infertility, are often considered to be something you just need to learn to live with. However, did you know that these symptoms are clues to the underlying cause of your ovarian cysts? Weight gain in itself is a sign that you need to make changes. Those extra kilos are your body's way of telling you that things are not right, and ignoring it means you risk gaining a steady 2 kilos a month until you choose to do something about it. Ovarian cysts can be a life sentence if you don't manage them correctly. However, with accurate diagnosis, causative identification, and effective long-term management, the symptoms of ovarian cysts can be reversed. It's not common practice to get our hormones checked, and they are normally not integrated into diet programs because they are so complex. But even the slightest imbalances, often found with the early changes of ovarian cysts, can make weight loss a futile exercise. This is because they are linked to a condition called fat cell sickness. This means that when exposed to excess hormones, toxins, inflammation, or genetic weaknesses, your fat cells can become stressed, leaking fat out into the muscles, blocking mitochondrial function, causing fatigue, and stopping your body's ability to convert glucose to energy. This means you have elevated glucose levels, and not only can't burn fat, but you store fat quickly, an impossible combination for weight loss with ovarian cysts. Worst of all, fat cell sickness leads to hormonal imbalances, which triggers further weight gain, accelerated aging, and lowered fertility. The reason ovarian cysts are difficult to diagnose is because they are misunderstood. The symptoms of hormonal imbalance can also cause discomfort. However, the good news is they can often be managed effectively in a natural and healthy way. In a nutshell, you respond to food and hormones differently from other women. The best treatment for ovarian cysts is one that is tailored to your individual needs. For some women, it can be a combination of medications, herbs, homeopathics, and most importantly, diet. You need to look for the right support that manages your ovarian cysts for you. Diagnosing ovarian cysts is one thing. However, identifying the cause is the key to you effectively breaking free from them. Your ovaries normally grow cyst-like structures called follicles each month. Follicles are little chemical factories that produce the hormones estrogen and progesterone and release an egg when you ovulate. Sometimes a normal monthly follicle just keeps growing. When that happens, it becomes known as a functional cyst. This means it started during the normal function of your menstrual cycle. There are two types of functional cysts. Follicular ovarian cyst. Ovulation initiates a complex chain reaction. The follicle holding your egg takes its cue from your brain's pituitary gland via a hormone called luteinizing hormone, LH, which is necessary for conception. When everything goes according to plan, your egg is released and begins its journey down the fallopian tube in search of fertilization. A follicular cyst begins when LH doesn't surge and the chain reaction doesn't start. The result is a follicle that doesn't rupture or release its egg. Instead, it grows and grows until it becomes a cyst. Follicular cysts are usually harmless, rarely cause pain, and often disappear on their own within 2 or 3 menstrual cycles. Corpus luteum ovarian cyst. If LH does surge and your egg is released, another chain of events starts. The follicle then responds to LH by producing large quantities of estrogen and progesterone in preparation for conception. This change in the follicle is called the corpus luteum. However, sometimes after the egg's release, its escape hole seals off and tissues accumulate inside, causing the corpus luteum to expand into a cyst. Although this cyst usually disappears on its own in a few weeks, it can grow to almost 9 centimeters in diameter and has the potential to bleed into itself or twist the ovary, causing pelvic or abdominal pain. If it fills with blood, the cyst may rupture, causing internal bleeding and sudden sharp pain. Traditional treatment involves medication prescribed to help lower hormonal levels. This can be effective for some women. However, getting to the cause of the hormonal imbalances is a more long-term solution. To move past the frustrations of ovarian cysts, we need to start to see things a little differently. Cysts are a medical condition. However, they are also a symptomatic expression of a cascade of imbalances within your body, stemming from a root cause. Getting to the cause of ovarian cysts is like peeling back the layers of an onion. Where did it start? What's fueling the elevated estrogen levels? These are the questions you need to start asking yourself. Finding the answers will give you freedom. Many women across the globe successfully manage their ovarian cysts. They overcome their symptoms and lead happy, healthy lives. The best part is they successfully conceive and fulfill their dreams of having a family. They are able to do this because they understand that their everyday food choices might be triggering hormonal imbalances or making diagnosed conditions worse. For example, did you know that coffee, wine, milk, spinach and soy are linked to hormonal imbalance? For some women, consuming these on a regular basis can make their symptoms worse and make losing weight impossible. To reverse this is simple once you know what's going on. Trans fatty acids, refined carbohydrates, synthetic estrogens, food preservatives, toxins, pain and inflammation, genetic weaknesses and other hormones can make cysts worse. Depending on your hormonal profile, certain foods will help you reduce your cysts, and others will make your cysts worse. Herbs and nutritional support are beneficial in supporting healthy hormonal balance. So the key is to get assessed and treat the cause of your cysts. You need to rethink a few things. The incidence of ovarian cysts is growing at an alarming rate. It has the potential to affect our friends, daughters and loved ones. There is no single treatment for cysts that works. Cysts are multidimensional. Effective management takes expertise, experience, dedication and time. We are here to provide you with the accurate, scientific information you need to safely reverse the underlying cause of cysts. Targeted symptomatic screening and functional pathology testing helps to identify the cause. Many of you know its effects on your health only too well. Upsetting symptoms such as acne, excess weight gain, abnormal hair growth, as well as infertility and menstrual irregularity. At MassAttack, we regard it as our responsibility to provide you with the knowledge and support you need to help you reverse the effects of cysts and their underlying cause. We want you to know we are dedicated to helping you restore your health, and we take this responsibility very, very seriously. We invite you to explore our website, visit our testimonial page, book in for a free review, and learn about the first complete system designed to reverse cysts and their symptoms. Remember, we are here to help, so feel free to contact us at any time to have your questions answered. We are committed to being your partner in restoring your health.